Hello, my name is Dr. Gary Radz. I am a general dentist in Denver, Colorado. And today I wanted to share with you a technique and a material that is relevant to today's particular situation given the current status of the world. Today is March 23rd, 2020. And the timestamp is relevant because many of us have had to close our offices and only are seeing emergency patients. So, like many of you, I am in my office out of habit more than anything else, but I am here developing my plans for what we're going to do when we reopen, but also I am here in case there is a patient in need of an emergency. And I think it's important that all dentists do have some availability to see emergency patients to decrease the overload that's happening in our hospitals at this current time. So what I'd briefly like to share with you is how you can fabricate an emergency crown in a single appointment that will provide the patient with weeks, months, maybe even years of service. The ability to do that is because of a new material that's come to market by DMG. This material is called LuxaCrown. LuxaCrown has been approved for use as a semi-permanent crown or bridge material that can be worn up to 5 years. I would like to walk you through the technique of fabricating these crowns, as I think many of you can find this useful in the upcoming weeks and months. For the example, we'll look at tooth number 4. Tooth number 4 has deep radiographic decay, and there's hot and cold sensitivity. There are concerns that there may be an endodontic issue waiting for this patient. So the treatment plan was presented to the patient. What we want to do is remove the decay and inspect the interior aspect of the tooth, making sure there is not a pulpal exposure, and then do a buildup and an immediate chairside crown. To begin with this, you need to get a pre-op impression of the existing condition. To do this, we are going to use a alginate polyvinyl substitute, in this case a material called Status Blue. And I'm going to reline that with a fast-setting light body wash material, Honeygum Quad Fast, to get detailed accuracy in the impression, because this impression will be used to fabricate the final crown. As a quick side note, if the crown has fractured and there's a missing tooth structure, you can quickly build up that area with composite resin material and do basically a wax up in the mouth to restore the missing tooth structure so that you can get an accurate pre-op impression. In this picture, the decay has been removed. We've used caries detector to make sure all the decay has been removed. There is no pulpal exposure. However, we are very close to the pulp, so a liner will be placed and then a buildup on top of that. The preparation is isolated with a 360-degree style matrix band. This is an Omni matrix. The area is etch, primed, and bond. And then a dual cure composite resin buildup material called LuxaCrown is injected to restore the area where the tooth structure is missing. The LuxaCrown is then light cured and is ready for preparation. And then this is the photograph of the final preparation. For the LuxaCrown material, I have found that a heavy chamfer or almost shoulder prep is most ideal so that when we are trimming back the margins, we can get great accuracy because we're able to read the margins better. So in this photograph, I have done the final preparation with a heavy chamfer margin. Now, to fabricate the crown, the LuxaCrown material is injected into the pre-op impression of number 4 and seated to place. This technique is exactly the same as the technique you would use to fabricate a temporary crown. The pre-op impression is allowed to sit for 3 to 4 minutes, removed from the mouth, and now it is ready to be trimmed and polished. I have found in my practice that many different composite resin polishing systems work well to remove the excess and finalize the crown to margin. There is in fact a kit that Brasseler makes that is specifically designed for the LuxaCrown material, and that photograph is shown in this slide. Within 3 to 5 minutes is all it's going to take to get the crown trimmed, polished, and ready to be cemented. When you're going to cement the crown, you have really, I think about having 3 different options. If I know that crown is going to be in for a short period of time, 2 weeks to 2 months, I'll use a temporary cement such as the TempoSem ID. This will allow me to easily remove the crown when I am ready to take the final impression. If I think I'm going to be keeping the crown in for an extended period of time, 3 months to a year, and or if the patient is very caries prone, I can and will cement the crown with a glass ionomer cement. If I think the LuxaCrown is going to be in place for a year to 5 years, then I frequently will use a dual cure self-etch composite resin cement such as the PermaSem 2.0. So depending on your situation, you would choose one of 3 different types of cement. So you need to look at the clinical situation and make that determination on your own. This is the final crown cemented into place. The intent for this patient is that they're going to be wearing this for 3 to 6 months as we monitor the tooth in the endodontic situation. So this particular crown was cemented with glass ionomer cement. The final thing we'll do is check and adjust the occlusion if needed, and it can be polished to a high shine. And this will serve the patient for an extended period of time. The next question may be, what are the insurance codes for this? The manufacturer of LuxaCrown, DMG, has recommended these codes can be used to submit to insurance. So during these times where we have limited time and availability to be working in our office, and we all know that patients will fracture teeth and they are going to have emergencies, and some of those emergencies may require that patient to have a crown, having the ability to use LuxaCrown as an alternative for a one-appointment emergency crown to give the patient a restoration that they will be able to last for an extended period of time until our offices can go back to our normal function and routine is a great option for dentists to have. So if you've not tried this material, I would encourage you to have it on hand because it may in fact become very handy in these times where we have to service patients and our clinical availability and abilities are limited to the current situation. Thank you. I can be reached at gradz@smilesource.com should you have any questions. Thank you.